I'm Dr. Tim Harris, and I'm one of the orthopedic surgeons here at Wake Orthopedics. As you prepare for your upcoming surgery, I'm sure you've given some thought to what the experience will be like. You may have questions such as, will it hurt? How quickly will I recover? Or how will I manage my pain? All of these concerns are perfectly normal. This video is designed to introduce you to an age-old tool for pain management. And it doesn't require any fancy tools, technology, or medications. You just need to learn how to do it. Mindfulness is a scientifically proven method to help patients manage pain after surgery. If you're skeptical that a simple mental exercise could help you control pain, I get it, because I'm a fairly skeptical guy too. Plus, as surgeons, we like to believe that recovery is all about technical precision and how skilled we are at the procedures we perform. And while skill and training are critically important, we've learned that patient mindset also plays a key role in recovery and pain management. I recently underwent a shoulder surgery, and I tried this simple tool and found that it had a profound effect on my pain and recovery. Throughout this brief video, we'll be explaining how and why mindfulness works. We hope that by the end, you'll be willing to give it a try as we continue to research and explore this important tool. While it's normal to be a bit nervous about your procedure day, remember that your care team is here to support you and that having surgery is designed to help you get back to doing the activities you enjoy most. Your care team will include operating room staff, nurses, physical therapists, your surgeon, plus your family or caregivers. This team has already been preparing to make your surgery as smooth and successful as possible. With most surgeries, there is some discomfort associated with recovery, but there are many people and numerous tools to support your recovery and healing. After you're discharged from the hospital, you may participate in physical therapy to help you overcome any mobility challenges. It's also likely that you'll use pain medication, either prescription or over-the-counter, during your recovery. Lastly, we're encouraging our patients to practice mindfulness to help manage pain and enhance recovery. Mindfulness is a mental exercise that's been around for thousands of years. It's been scientifically proven to help manage pain and improve recovery for surgery patients. It's not religious or time-consuming. It's also not having a blank mind or simply not thinking. Mindfulness also won't conflict with any other part of your recovery. And you may find it useful long after you've recovered. Mindfulness is the awareness that arises from paying attention, on purpose, in the present moment, and non-judgmentally. Jon Kabat-Zinn. When our body experiences pain, we react to it. This is a hardwired protective mechanism. There is the physical pain we experience, but there's also the story we tell ourselves about the pain. For example, this is never going to end, or I'll never get back to normal. Or, this is temporary and part of the healing process. Mindfulness helps break the tendency to exaggerate the pain and makes us more aware of the story we tell ourselves about the pain. Here's a brief lesson on how the brain works. When we perform a behavior, our brain creates neural pathways. Think about playing a musical instrument. With repetition, these pathways become more concrete, and with time, we form habits. These habits make it easy for our brain to function on autopilot and free up space for other important brain functions. However, once these pathways are created, they aren't set in stone. Until the day we die, we have the ability to change and modify the pathways. In other words, you can actually change the way your brain works with practice. Mindfulness practice actually reduces activity in the areas of the brain that play a role in our interpretation of pain. This has been confirmed with MRI studies, where the activity of different brain regions is visible in real time. This means people who are more mindful are less caught up in the experience of pain. Fact: a simple mindfulness intervention in hospitalized patients decreased pain and stress compared to control groups. Fact: studies in total joint replacement have shown that patients who were taught mindfulness meditation had improved post-surgical pain and function when compared to control groups. Did you know that mindfulness gives you the ability to shift your thinking? Here are some examples. Imagine yourself on a highway and you've just been cut off by a reckless driver. There are two ways you can think of this scenario. This driver is inconsiderate and has no regard for humanity. He or she is out to hurt or inconvenience others. Or perhaps this driver is rushing to the hospital to meet her child, who has just been seriously injured, or perhaps some other emergency. Similarly, imagine yourself after surgery. This pain is unbearable. I feel miserable and I just want to lie around and sleep or take medicine to numb the pain. Or this pain has a purpose. It's helping me recover and heal my body so I can get back to enjoying life soon. In both cases, instantaneously and without a change in what has actually occurred, your perspective has completely changed. Practicing this type of mindfulness regularly not only helps you reduce stress or pain in the moment, but also creates structural changes in how your brain can process stress and pain in the future. Hopefully this video has inspired you to use mindfulness to help improve your pain after surgery. To develop the habit before your procedure, we recommend working on mindfulness at least 2 weeks before your scheduled surgery. We will give you the links to listen to audio files that introduce you and guide you through several mindfulness exercises. They are simple and less than 10 minutes long. Once you're comfortable, you can practice mindfulness anytime, anywhere without the audio files. We encourage you to engage your family and caregivers in the use of the audio tool. Based on scientific research, we're sure this technique can be a powerful tool to help you through the healing process. We are most grateful for your willingness to explore mindfulness with us, and we welcome your feedback. Thank you for choosing Wake Orthopedics for your surgery.